One-Tom Plumber office is located at 509 South Eli Highway, and their number is 928-267-3411.
And we really appreciate One-Tom Plumber and their sponsorship of the KRIM Community Spotlight Program. Good morning, Rim Country. Chris Higgins in the studios here in the Sawmill Theater Movie Complex. And on today's program, we have the CEO of Banner Payson Medical Center, Hoyt Skabelund, in the studio. Good morning, Hoyt.
Good morning, Chris. Thanks for having us. We sure appreciate having us as guests each month, and really appreciate this partnership.
You are so welcome. Thank you. Thank you and everyone affiliated, associated with Banner Payson Medical Center and all they do for our community, serving our community. I really love having and enjoy having the different professionals come in from the different departments in the hospital and just have them share about themselves and also how much they love this community. That's a common theme, that they love working for Banner. It's a real family and they love the community.
I think Payson it's the heart of Arizona, and there's a reason, and I think I'm glad everyone doesn't live here. I'm glad those that love living here are primarily those who choose to live here. And I was talking to a hospital CEO from Nebraska yesterday, and they're struggling with continuing to struggle with recruiting nurses and staff, paying $1 million in premiums to staff their hospital. And he asked, how are you all doing? And I was pleased to be able to say, well, we do have some temporary staff due to people being on medical leave or paternity, maternity leave, those kind of things. But our level of use of travelers is below that before the pandemic, which is really amazing. And he asked, how do you do that? And I said, well, kind of what you said, Chris, is we have a wonderful community. And people are drawn to want to live here and to stay here. And if you can create an atmosphere that is a great place to work, I think that helps them choose to work there and live where they want to live. Housing remains a challenge. We know that.
Yeah.
We know that, and but despite that, people are sacrificing to come and live and work here, and we're thrilled. They're amazing.
Well, Arizona, such a beautiful state. Such a beautiful state. Payson, Rim Country, just I think one of the most beautiful parts of the state. But there's so many beautiful parts of Arizona, and I just pulled up Nebraska, and 52 cool, hidden, and unusual things to do in Nebraska. When one of your top 4 is the world's largest ball of stamps, it's maybe a little bit harder to draw people. In Nebraska, I've talked to people that have lived there, been stationed there, and it has its charm, and definitely good people in the Midwest. Great people in the Midwest. But as far as natural beauty and just wow, we're just so blessed in weather. We don't get the ice storms, tornadoes, different things. Yes, forest fires, but so that has to help, I would imagine.
No question. I would say my favorite location that I've lived in my career is Payson, Arizona. It's beautiful. I love the proximity to the big city and the airport if I need it, when I want it. 90-minute cushions, really nice. Every morning, most every day is blue sky. The climate's usually temperate. Boy, I'm a little cold the last couple of weeks, but that's okay. It's cold wherever I've lived, so it's still more mild. We're blessed to be here. Which reminds me of something that's not related to the hospital, but it's for all of us listening. So I'm really speaking for myself, not for Banner here, but I think Banner would be very supportive. I've learned of a day of prayer that's been designated for Sunday, February 9th, to pray as a community of whatever your faith, your religion, wherever you believe the Creator can come, but to pray for moisture for Rim Country. And so there might be events that are created around this, but it doesn't need an event other than just that Sunday. If you could in your prayers ask good Lord for moisture, whether it comes in rain or snow, we'll take it, and really would like the forest to take a big drink
Yes, oh boy.
And we know that to get to the roots of trees, you can't just have a light sprinkling that evaporates before it gets there. We need some significant moisture, and we haven't had any this winter.
Yeah.
And that just creates greater fire danger, and we'd like the California fires to end and be managed, but we certainly don't want to have to live anything close to what they're doing. So I love whoever developed this day of prayer for moisture for Rip Country on February 9th. I hope any listeners that are praying people that would make a note of that.
Mhm.
I'll certainly make a note of that and make that a day for me to pray for moisture.
No, that is, yeah, it would be great to see some moisture. I know I saw, in Phoenix, I think they're at 140 days without any moisture. The record is 160.
Wow.
So, and the second longest stretch is 147, so by the end, or this time next week, they'll, unless they get something, but it's not forecasted, they'll have, over 147, 148 days without any moisture, and probably, I don't know, 160. It seems like it's very obtainable.
Oh,
this
it's something
winter.
that's possible. I think about the miracle of rainfall and snow is, I'll stand out if I was to stand in my yard and need to water every tree deep enough to its roots, it would take a lot of time, and it would take a lot of water through a small
Yes.
little hose. And then when we see, just like Mother Nature can bring truckloads of water in a period of a couple hours, and you couldn't water your place as well as Mother Nature can when it cooperates. And so I'm hoping that's one of the things I have liked to believe, that the people in Payson are God-fearing and have the best of intentions, despite the contentions that it seems that we can never seem to get away from. But I would hope we could all unite this, that we could all want the best for the community with rain and moisture, and we could all turn to God and ask for His mercy to shine upon us and bring some moisture. My hope.
Amen. So, Banner, I know there's always things happening, changes, new services being provided, new people coming in. So
Yep, I've got a little list to walk you through
Yes.
today. You're
Sounds
stuck with
great.
just me today, but I thought this might be a good opportunity to keep folks updated. One thing I would like to start with is there is a new ENT service in town, and it's on our campus, and it's the National Science Institute. The reason I'm mentioning that is they are beginning to perform surgeries at the hospital in the month of March, and we're excited about that. They will have a nurse practitioner who's an ENT trained. ENT stands for ears, nose, and throat. So typically allergies, lingering coughs, nasal issues, ear tubes for children, these kind of things, tonsillectomies, these are the types of things that they typically treat. And so we have not had an ENT that's performing local surgeries or focusing on general ENT services since 2018. Dr. Friedman does ENT, but he's mostly focused on plastics. And so it's not, and doesn't have privileges in Payson at the hospital. And so this is a great advance. The name of the group is the National Sinus Institute. They're located in many states, and they are well known for bringing ENT surgical services to rural America, and they're really, really good at it. Cliff Parks is their CEO. I've known him for over a decade, and I'm thrilled that we are finally able to work together.
And I just saw when I was down at Banner Desert the other day, the other name for ENT that I guess is starting to be used. Do you know
Otolaryngology.
Yeah, otolaryngologist.
That's why they use the term ENT.
Oh my gosh,
because it's abbreviation
otolaryngologist.
for.
I know. I saw that on a window. I had to look it up. I thought, what is that?
Yeah.
And I thought, oh, ENT. Okay, that's
kind of above the shoulders is their focus, not brain,
yes.
but all the sinuses in
and everything.
particular, and your adenoids, your ears, your
yeah, ear
adenoids.
canals.
Yeah.
Wow.
A lot to do with the immune system in a lot of ways, and it's a complicated area, and we're grateful for it. The
Yes.
National Science Institute is also planning to include in their clinic. Their clinic's located at 803 South Ponderosa Street in Suite C. That's where Banner Medical Group formerly operated a pediatric clinic.
Okay.
And so it's right there across the parking lot from the hospital, ER and main entrance. And so they'll be initially a day a week or every other week, and then they've already seen such high volume that they're anticipating they may end up eventually being open every day of the week.
Oh, wow.
And they'll
Okay.
bring audiology as well, because obviously that fits really well with their services, and many of their patients will need to see an audiologist, and there'll be hearing aid components of that, and so that'll be really nice. The phone number, if you are in need of seeing an ENT in Payson, their phone number is 928-478-8410. And so you can call and schedule and get in line to see at your convenience in your own town an ENT. And then we won't be doing tonsillectomies initially, just because with the small kiddos. They want to start with more tubes and other more sophisticated surgeries. Tonsils are in the future, which will help parents. Having been a parent of 2 children that needed tonsillectomies, and we lived an hour and a half away.
Oh, wow.
I've been there. So parents here today are having to travel to the valley for that. We're hoping in the next year or so that we'll be able to offer tonsillectomy. In partnership with the National Science Institute to offer tonsillectomy. So that's something I wanted to share that's new in town and involves the hospital.
Oh, that's great. Also, just want to say really quick hi to Carmen Galindo. She said, good morning, Chris and Hoyt.
Hey.
So good morning, Carmen, watching on our KRIM radio Facebook live stream. And no, it's great. That's something that it has been really wonderful to watch, is the progression, the development of Banner Payson Medical Center since it first came to Payson, how it's grown with all of the different services that are now offered to residents in RIM country based on the needs of the residents and what Banner has seen, where there's been a need. You have addressed that, looked at that, analyzed that. Usually, if it's a smaller need, bring someone in on once a week, once every couple weeks, and then as the need grows, then that service grows, and it's just a smart way to do it. But it's great because our residents, we benefit from that.
It's our goal. Thank you for recognizing that. And it's not always smooth. So there's probably a listener or two who have been involved in newer services where there's ups and downs and volume, and but it does take about 3 years is the typical time frame to work out all the kinks and bugs and get the right amount of provider to the right amount of patients. So we partner with Advanced Spine and Pain. We've had them on your program before to try to bring advanced procedures in the operating room and to help manage pain procedurally after other options are exhausted. And so that's beginning to smooth out, and they've recruited a couple additional interventional pain specialists, physicians, who will be allowing us to gradually expand the number of days available to be seen. There's quite a wait time. We knew there was a need. We underestimated the magnitude of that need, so we're going to grow the interventional pain specialist services. We still have our sleep lab that we reopened. We often have capacity in our overnight sleep lab. Nearly every we operate 3 nights a week, and we typically have a bed open. And so there's capacity there, but we do a lot of at-home studies. So we try to start with at-home studies whenever indicated. It's easier for the patient. Insurance companies prefer it because it's less expensive. But then when those at-home studies indicate a need to come in in a controlled environment for an in-lab study, we have that service. And so we're not in danger of closing that service, but there's capacity there. So that's an example of a service that is settled out and there's excess capacity, which is a good thing. Oncology, we are seeing great growth with Jody Strand and her work, and Dr. Avarish through telemedicine for him. Jody, boots on the ground. Our chemotherapy volume is exceeding previous highs, and so we're able to serve more oncology patients. Based on our studies, roughly 230 community members in Rim Country are diagnosed with cancer every year.
Mm.
Now, in some ways, that's a small number, but
Yeah.
230
Percentage-wise.
people,
Oh,
put them in
yeah.
a gymnasium, there's a lot of people that have a life-threatening condition
And you said every year.
every year.
So,
Yes, and some of
yeah.
those people will struggle with the battle with their cancer for many years, and so the cancer center that we're hoping to create, we're having some real growth, and the good news is we have Dr. Sanal Thacker,
Mhm.
who, he's agreed to a contract with us. He is ready to, we're revising it to sign it. I'm hoping in the next week that'll be signed. He's beginning asking more and more details. He helped create the program, the cancer program in Globe,
Mhm.
and the cancer program in Shola
Mm.
that has successfully operated for, in each of those cases, more than a decade. And he's agreed to come and work closely with us over the next 3 years, and he'll be on site twice a month, which will be the greatest amount of oncologist on-site service that Payson's ever had.
Mm.
Banner MD Anderson intends to be part of this with us. There
Mhm.
won't be a labeled Banner MD Anderson service, but we've got a lot of plans. We are exploring the ability to reestablish radiation oncology services.
Mhm.
It's a $10 million venture.
Mhm. Wow.
And that's massive.
Oh,
That will be
yeah.
one of the largest, I would say that's the largest investment in any particular service line of the hospital, possibly on record for us, and so we're looking at that.
And thinking back to those numbers, you said 230 a year on average. So 5 years, you're talking, 6 years, that's over the population, or
1,000.
1,000, it's
10%.
10%. It's 10% of the population of Payson. That's a big number.
That's a big number.
And
When you think about in dialysis terms, that's another area of concern that we've been focused on.
Mhm.
There are more dialysis patients. The diagnosis, there's not 230 new diagnoses a year,
Uh-huh.
but it's an equally important diagnosis, and
Yeah.
it becomes life-threatening, and it becomes a huge impact on the quality of life. Banner, we are good at cancer care. This is where we're focusing, and it has the volume to be sustainable
Mhm.
in a way that we can break even on it. It won't be highly profitable for us, but we're not for profit, not everything that we do. We need to overall generate enough of a profit that we can reinvest and sustain without any risk of closure.
Yeah.
So you have to be careful about your portfolio balance, that overall that it's sustainable, and every service isn't at risk of break even only, because you can't sustain on
No,
that.
no.
So there's some real hope. I hope in the coming months, within a year, I hope to be sitting here in a year that we're talking about the launch of some significant new services related to oncology.
Mhm.
And if not in a year, 2 years. I mean,
Mhm.
$10 million is not something you get an easy approval on.
Mhm.
We do have some grant money that we we have a very strong lead for a grant that could help with $1 million of that.
Mhm.
That may not be enough,
Mhm.
and so we may have to keep going back to the drawing board, but this is something I'm passionate about. I hate to see 220, 230 patients have to travel to the valley for all of their cancer care, when we could partner with the Banner MD Anderson and you could get the same level of treatment. And then in those cases if it's subspecialty cancer care, I don't know what percentage of the 230 may require that, but let's say is it 25% of that? Usually it's 15% or less. They may have to travel to the valley, but they could start treatments here until it becomes known they need to transfer. It'd be a tremendous benefit to those cancer patients and their families to help lessen their stress during the most stressful time of their life. And so I'm excited about that. So we got ENT, we've got some oncology advances that are coming. We've celebrated in previous programs the 5-star, the CMS Center for Medicare Medicaid Services, the 5-star rating, which places, so we received that recognition in August, and it sustains for about 9 months, and then we'll be recertified. And an example of how hard it is to sustain a 5-star rating, if our inpatient hospice partners' beds are full. And so if a patient is not able to have their life sustained, and no matter what knowledge, science there is, this is the end for that patient. We want to transition them into hospice care where they can receive, them and their families can focus on the end of life and do everything they can to make that the best time that they can. Well, when those beds get full, if a patient their next option to pass may be in the hospital. And if they're in our ICU and that happens and they're inpatient designation, then that becomes a mortality. Well, that mortality gets calculated into a rate that each hospital has. Well, that mortality, even though you were taking best care you could because of the resources in the community at that time, it counts against your rating. And it almost reflects that you have more patients dying than what we allow for this 5-star rating. So that's an example of how complex it gets. And so you can get a black eye on the rating when it's not deserved, when you're doing the best thing for the patient, and that is to keep them and support them when there's not another option. At home hospice is a great option, but sometimes that's not an option for a patient. So we're excited to have achieved a 5-star rating when it's that challenging, and there's over 30 indicators, and each of those indicators are super complicated. So the likelihood of us sustaining a 5-star rating is not high because there's just so many moving pieces and parts, but we hope to be a 4-star or 3, 4, 5-star rating in our entire existence up here. And we're gonna spike the football when we are 5-star and 4-star because we want people to know that those are great periods of time. And even when we're not a 5-star, and we're close, it could be one indicator, So we're very proud of that. There's only 5-star rated hospitals in the state of Arizona, and less than 8% of hospitals in the country are 5-star rated. And so I think it's a reflection back on the staff that have chosen to work at the hospital. They are amazing. Medical staff, volunteers play a role in this, our leadership team, and then the frontline staff that do this work every day are incredible. So on that note, we received a second award for the second year in a row. I think we mentioned it on a previous program, but I think it's worth restating. Chartis, CHARTIS. You can go online and check out Chartis. But Chartis is a quality management company nationally recognized for their work to increase the performance of healthcare quality in the country. And so one of the part of their mission and vision is to publicly recognize high-performing healthcare organizations to incentivize other organizations to follow best practice and to try to mirror high performance. So the Chartis organization has named Banner Payson Medical Center for the second year in a row a top performance leader. So it's a performance leadership award, and they have several categories. Our category is outcomes, which is what is our measured patient experience outcome? What is our measured clinical quality outcome? And our clinical quality and our patient satisfaction have qualified us to be in the top 25% of hospitals in rural America in those two measures. And we're proud of that. And to sustain that 2 years in a row is outstanding. We're very proud of that and grateful. And it was from someone outside of Banner Health in the CMS 5-star Top Performance Award. These are awards that you can't bribe and you can't create for yourself or pat yourself on the back. You're awarded from respected organizations on certain requirements and data that are indisputable. So we're very proud of that. So while we've been recipient, I thought we'd share that on the air.
Yeah, looking at their website, it's good. Meaningful outcomes, sustainable results. So,
We're proud of that.
Yeah, it's really good. Again, if you're just tuning in, program's almost over. I have another 5 minutes, but we're talking with Hoyt Skabelund, the CEO of Banner Payson Medical Center, and just going over all of the new services, awards, just things that are happening at Banner Payson Medical Center, and it's always exciting to hear what is taking place, and I believe Banner Payson Medical Center always evolving and always improving.
Trying, a couple examples of how healthcare equipment is expensive. Can I tell you?
Yeah, good.
And not
Tell
only
me, what?
is it expensive,
Tell
it's
me.
expensive to install. So we are completing here this month the replacement of an X-ray unit in our outpatient imaging center, which is located next door to Ponderosa Family Care and next door to Dr. Rex's dermatology group. And that unit that we're replacing with a digital unit, state-of-the-art, the unit itself is $500,000. And then to install it and to meet all the codes and requirements of healthcare codes and requirements, and it's another $500,000, so it's $1 million investment. So we're proud to do that. It always hurts when you do it, but these investments are for decades at a time, and so we want to have the best equipment, the best images. And then our MRI, magnetic resonance imaging, MRI unit is due for replacement, probably it's a 4-month project. And MRIs are typically, by the time this project will be over, $3 to $4 million to replace an MRI. And the newer equipment can accomplish more MRIs in an hour. So we have wait times today that this will create new capacity for us in the same space with one unit. So we're very excited about that coming. We replaced the roof, the simple things. The roof, a $700,000 project to replace the roof in the administrative building. When you do that, we had to replace sheeting, and we had to remove pipes off the roof. We wanted to make it more attractive, be a better neighbor, looks so much better. And then we'll be painting that building. We're presently, if you drive by the hospital back on Main Street, you'll see that we have construction fencing up behind the loading dock. We are building a privacy wall to try to improve the appearance from the street, create some safety as well, and so we're going to do that. Then we'll be doing some landscaping around the old administrative building, trying to, again, improve the appearance to match the quality of the care that we're providing on the inside. So we're excited about those types of investments. We'll be resurfacing and repairing our parking lots here in the next number of, I'll just say within 2025, and that will address some drainage issues and some ice, but also just improve the appearance with nice striped parking lot that's cleaned up. And so we're excited about those things. Last thing I'd close with is it's quademic season. Quademic is the new term they're using, and this is adding COVID to the traditional flu, RSV, and then you have the norovirus. So the norovirus is a stomach flu. This is diarrhea and vomiting. Thankfully, symptoms last only 1 to 3 days.
That is
it
good.
Can be deadly for the elderly who do not have support systems to keep them hydrated. You can quickly become dehydrated. Most elderly are already dehydrated, and it is dry. If you put lotion on, we're not drinking enough water as a people. And so the scary, good job. The scary part about norovirus is that it is highly contagious, and you don't know that you're spreading bacteria because you can be contagious before you show symptoms. You're contagious especially while you have symptoms, vomiting and diarrhea. And then after your symptoms have subsided, you remain contagious.
Wow.
And so what happens, this is what wipes out schools. This is, it's happening across the country. Widespread is expected the next 4 to 6 weeks to be particularly pronounced. And alcohol-based hand rub is not effective against it. So C. diff is a higher bacteria. C. diff is also not effective. Alcohol-based hand rubbing, hand washing is all you got.
Hand washing. Wow.
So it has droplets. So when you cough, cough or fecal matter. I know that just sounds terrible, but changing diapers, and the child has it. You just have to really wash your hands in the 20 seconds. Soap and water is the only thing to prevent the spread. So when you're sick, stay home, please, and then recognize that you've been contagious. Wipe down all the surfaces in your home, particularly refrigerator doors, bathroom door handles, flushing on your toilet, anything that you touch after you use the restroom, or cough, or vomit. So it sounds terrible, but I'm just trying to say, keep yourself healthy, your family healthy, and if someone in the family has it, kind of quarantine them, try to keep them isolated from the rest of the family. Don't have them go open in the refrigerator and touching surfaces where you're going to touch your nose, your mouth, your eyes, and so stay healthy, please.
And I know it is a little harder washing hands now because of how dry it is. So if you're washing your hands more frequently, your hands are drying out, so...
You avoid washing your hands.
Yes, you think, oh, my hands
wash
are
them
stinging. Yes, so, but it is even more important now, this time of year.
Children, just one final thing, infants, this norovirus affects every age. So with infants, be really cautious about hydration.
Pedialyte.
Keep them in what they're on a bottle, and so just be really careful and don't wait too long to go see a doctor where they might need to do an IV if they've been days with vomiting, diarrhea. Babies and elderly can become dehydrated even more quickly and are less sensitive to recognizing they're dehydrated. So anyhow, it can be managed. I don't mean to scare. I think it's more about being cautious. I hate vomiting, I hate diarrhea.
Yeah.
It's just best to avoid if you can.
Anyone I meet that says they love those two things, I would be concerned, right? I'd be very concerned. Yeah. Well,
needless to say, sorry about that one.
Thank you so much, Hoyt, for coming on today. Thank you again, everything that you and everyone at Banner Payson Medical Center does for our community. I want to thank One Tom Plumber also for sponsoring our Community Spotlight program. And thank you to you guys for listening and watching. Hope you have a beautiful rest of your day. Time to get back to the music with some Looking Glass, Bachman Turner Overdrive, Rolling Stones, and more. But first, let's get a quick update from the National Weather Service.
With this morning's KRIM weather forecast for Payson.
All right, see you guys.